The popliteal vein, which drains the fossa, accompanies the artery through the region. With some of the muscles of the leg reflected, we can trace the continuation of the popliteal artery into the leg. Just below the knee, the artery divides into the anterior tibial artery and the posterior tibial artery. Each artery generally travels with two veins of the same name. The anterior tibial artery exits the posterior leg to reach the anterior leg through an opening between the tibia and fibula. The posterior tibial artery descends in the posterior leg. One of its largest branches is the peroneal artery, which supplies structures of the lateral side of the leg. The posterior tibial artery continues to descend toward the ankle and furnishes branches to the structures of the region. After it crosses the ankle, it divides into medial and lateral plantar arteries, which provide digital branches to the toes. In this view of the anterior leg, we can trace the course of the anterior tibial artery after it exits from the posterior leg through the opening between the tibia and fibula. It lies deep between the muscles and supplies structures of the anterior leg as it descends toward the ankle and foot. Branches of the anterior tibial artery furnish blood to the ankle region before it enters the foot as the dorsalis pedis artery. In this presentation, we reviewed the major arteries and veins which form the pulmonary and systemic circuits of blood circulation and identified many of them on our specimens. The anatomy of the heart and the circulation of blood through the heart are described in the videotape, The Human Cardiovascular System, the Heart.